Here we go. So welcome everybody to Saybrook's Self-Care Mindfulness Moments program. And today we have a very special treat. Dean Donald Moss with Saybrook University is going to be talking to us about his work, which is very well known throughout the planet, throughout the globe, and he's one of the foremost experts in this area. And he's going to be speaking to us today about brain-heart interaction and optimizing psychotherapy. So Dean Moss, I'm going to hand it on over to you. Thank you for being with us today.
Thank you, Luann, for the invitation to be part of this series, and thank you for that introduction. Again, my topic is brain-heart interactions and optimizing psychotherapy. I hope there are elements in this program that will be valuable for everyone present, whether you're a psychotherapist or not, and I'll come back to that as I close later. So what am I going to cover? The first thing I'm going to emphasize is that psychotherapy is more effective when there are some physiological supports that support three things: interpersonal engagement and compassion. We know that we have to have a therapeutic alliance between the doctor and the patient if we're going to have effective psychotherapy. Secondly, psychological flexibility. People often come into therapy because they're stuck. And if they're too stuck, it's even hard to do psychotherapy. But when we can facilitate some flexibility, the therapy is more effective. The third thing is emotional regulation, also autonomic nervous system regulation, because those two go together. When I regulate my emotions, I'm usually balancing my autonomic nervous system. So this webinar is going to look at the physiology, the neurological supports, and the hormonal processes that support these three processes. So I'm going to look at things that happen in the body that facilitate engagement, flexibility, and regulation. I'm going to look at particular approaches to research: Stephen Porges' polyvagal theory, Julian Thayer's neurovisceral integration therapy, Paul Gilbert's compassion-focused therapy, and Kirsten Uvnes-Moberg's research on oxytocin. Finally, there are several pathways. If we want to get more heart rate variability, if we want to get to this more optimal state, there are several mind-body interventions that can enhance positive heart-brain interaction and support effective psychotherapy. I'm supposed to make a disclosure of any conflicts of interest that I have. I am co-editor of an Oxford University Press book with Patrick Steffen, my friend and colleague. The book is called Integrating Psychotherapy and Psychophysiology, and I do receive royalties for this work. Otherwise, I have no other conflicts of interest to disclose. I want to begin with Jane Goodall. Many of you know Jane Goodall's work, and she made the comment that really caught my attention. She said, "We need to connect our brains with our hearts and appropriately use our innovative technology as well as indigenous knowledge to make wiser decisions about people, animals, and our shared environment." Now, when she says connecting our brains with our hearts, that's not just a metaphor. We actually can better connect our brains with our hearts, not only in our lived experience, but also in our physiology. And we do have innovative technology that facilitates that brain-heart connection. And there is quite a bit of indigenous wisdom that can also guide us. So that's the message of this lecture. How can we better connect our brains and our hearts? Well, I've mentioned Stephen Porges. Stephen Porges developed the polyvagal theory, and it's a physiological theory, but it's also a theory about human attachment, human engagement. Porges' theory says that the vagal system in our body, the vagus nerve, provides the physiological foundation that enables us to engage socially and develop compassion. Now, the vagus nerve is pictured on that slide. It's a long, winding, wandering cranial nerve that regulates many organs throughout the body. Now, people used to think of these nerves as one-way paths, the brain controlling the body, but in fact, it's a two-way highway between the gut and the brain, the heart and the brain, with many more connections. The vagus nerve is also the primary carrier of our parasympathetic nervous system. Now, that's the part of the nervous system, part of the autonomic nervous system that allows us to quiet, to soothe ourselves, to rest and restore our resources. And the vagal nerve carries 75% of parasympathetic activity between the brain and the body. Now, Porges' theory is an evolutionary theory. He proposes, and this is somewhat controversial, but he proposes that there are two vagal nervous systems. There's a more primitive one, which is not myelinated. That means those nerves are not coated with a myelin sheath. It's also called the dorsal branch of the vagus. And then there's a later part of the vagal system which is myelinated, which means that the transmission is it's faster and more efficient because there's a coating outside the wires, so to speak. And Porges asserts that the myelinated vagal part of the system developed at the same time that mammals developed the caregiver role. Now we know that mammals carry their young in utero for an extended period. And then when the young are born, they're immature, they're not able to care for themselves. It's not like the turtles that come out of the egg and walk immediately to the ocean and swim. The human infant and the infants of other mammals require extensive care from parent figures. And Porges believes that the myelinated vagus emerged at the time that mammals began to give birth to immature young. So the myelinated vagus enables that social engagement and compassion that's necessary for infant-parent bonding. And it remains the support for our social engagement and our compassionate involvement with other human beings. Now, social engagement is part of our evolution. Our central nervous system, our autonomic nervous, and our hormonal system, the endocrine functions, all support in mammals and especially in humans this level of social engagement that makes us different from lower species. Creating calm states and conditions of safety and trust increases the activation of the vagal system and enables this human social engagement. In turn, when we're engaged, it serves to regulate distress and negative emotion. We talk about resting as a form of moderating stress, but we also have what's called the tend and befriend reaction. We seek out and contact with others when we're under stress, and we soothe one another. However, when we're distressed, when we experience trauma, this disrupts the compassionate engagement and it disrupts the ability to experience safety. So vagal activation, when the vagal system is activated, it creates the conditions for safety and connectedness. And I'm going to quote a researcher who said, the present results suggest that cardiac vagal indices, that's the cardiac activation of the vagal nerve, presents a biomarker of the degree to which people can feel safeness in their environment and connectedness in their social environment, enabling us to live an orientation of acting with intention. So some of the fundamental traits of being a human being are made possible by this vagal activation. So this is the kind of an encapsulation of Porges' polyvagal theory. The myelinated vagus enables parasympathetic activity to rest and digest. So we're recovering from stress. We're socially engaged so we can tend and befriend one another. It also enables executive functioning. And we'll come back to that when I talk about Julian Thayer. because the brain is facilitated in its activity by this parasympathetic activity. On the other hand, when we're endangered, when we experience danger, the sympathetic nervous system gets activated, hyper aroused, and then we experience fight or flight, and we actively either run away from or attack the danger. The parasympathetic unmyelinated vagus responds differently when it experiences threat. We become unaroused, non-aroused, or hypoaroused. The vagal system withdraws and we dissociate. You see that cat carrying the mouse. The mouse is not dead. It's showing that hypoarousal response to threat. It kind of goes limp and plays dead. And sometimes the predator will drop the prey because it doesn't feel like a live meal anymore. So that's the possum response, we call it, playing possum. And human beings do some of this as well. And according to Porges's theory, it was the non-myelated vagus which came about to allow this vagal withdrawal response. Now, Porges points out this is not just something that happens inside the person. This is something that happens between one person and another. And he points to the mother-infant bond as the primary example of that, but it also goes on between two children or two adults. This is a kind of a co-regulation where we make eye contact, we bond with one another, and we experience comfort and safety with one another. Two nervous systems in a dance with each other, mitigating threat and experiencing safety. And the vagal nerve is activated when this kind of co-regulation goes on. On the other hand, when you have early trauma, early adverse experiences, it diverts the organism from this whole caring compassion response, and in fact interferes with the ability to carefully bond with another and experience safety. It disrupts the development of compassionate experiencing. So what are those optimal conditions for that infant bonding, other mother-child bonding or parent-child bonding? Well, it involves face-to-face engagement, eye contact, skin contact, reciprocal delight. There's a playfulness where the mother and child enjoy one another, reciprocal smiling and laughter, and prosodic vocalization, the baby talk, the rhythmic talking, the sing-song talking that we do with infants. And some of these characteristics show up in adult compassionate bonding. Now, in my introduction, I referred to heart rate variability. The vagal nerve also is the primary vehicle enabling what we call high heart rate variability. When there's a lot of vagal activation, we have smooth rhythmic variation in heart rate. Heart rate goes up and down, lots of variability. When I was a young psychologist and started using heart rate as a biofeedback device, I was frustrated because heart rate was all over the place. I wanted it to be more level because it was hard to write down what was the mean heart rate. Well, it turns out this variability in heart rate is actually more important than how fast the heart is beating. Now, they're correlated. Lower heart rate typically is correlated with higher variability. But in any case, this variability is an index of vagal activation. It's also an indicator of mental health and physical health. When you have low heart rate variability, which means low vagal activation, you're much more likely to have anxiety disorders, depression, negative emotion, hostility, post-traumatic stress. When you have high heart rate variability, you're more likely to experience good mental health, positive mood. Higher heart rate variability brings about a calming, a safety response, and a positive emotion. And when we do some kind of training that increases heart rate variability, it facilitates these processes. So I'm pointing out a very close connection here: positive mental health, high heart rate variability, and high activation of the vagal nervous system. Now, there have been some critics speaking from a standpoint of anatomy and physiology saying Porges's portrayal of these two different vagal structures may not be accurate. Giraud and colleagues have argued that the polyvagal theory is very useful for what they call heuristic value, meaning it's generating a lot of self-care and self-regulation approaches in healthcare and in mental health care. And even if Porges is wrong about some of the evolution, many of the remaining conclusions that come out of polyvagal theory are still valuable. For my purposes today, I'm going to talk about vagal activity. I don't care whether it's myelinated or non-myelinated. There is a lot of research on vagal activity in general. It is correlated highly with heart rate variability. It's also correlated with some positive things happening in the brain. When we have high heart rate variability, the cortex is more, especially the frontal and prefrontal cortex, are more active. They're better involved, better engaged with emotional regulation and also with social engagement, what we call pro-social adaptation. So I'm going to set aside Porges's claims and leave those aside, not my concern. The rest of what I'm going to present is valuable, whether or not his theory is entirely accurate. Porges himself drew some conclusions from his theory about therapeutic involvement, and he had a great deal of concern, has had a great deal of concern with mental health. He actually ran clinics for people on the Asperger autism spectrum. Porges points out healing from trauma, healing from adverse experiences requires an establishment of a sense of safety in an educational setting or in a therapeutic setting, which enables transformation, emotional healing, and a restoration of safety and the caring orientation. So whether we're therapists, whether we're teachers, actually, whether we're any kind of a healthcare provider, we must be attuned to the subject's emotional state with attunement to facial gestures, vocal intonation, and gestures, our own gestures, and our own bodily response to the client. Now we're going to switch to Julian Thayer. His theory overlaps a great deal with Porges, but he actually paid more attention to the brain, the central nervous system, along with the vagal system. So Julian Thayer and his co-authors developed a theory they called the neurovisceral integration theory, showing the integration between the brain and the autonomic nervous system. Thayer cites evidence that the orbitofrontal cortex and the medial prefrontal cortex, so frontal portions of the brain, act to inhibit the amygdala, the emotional brain, through the vagal nerve pathways. So there's a strong connection between our cortex and the autonomic system and the emotional brain. And when we have strong parasympathetic activation, it facilitates the prefrontal cortex in doing its job, including emotional regulation. When we have low parasympathetic activity, then the prefrontal cortex does not function as well to do emotional regulation. So heart rate variability is a marker for how well the parasympathetic and vagal systems are working on the emotional brain. Higher vagally mediated heart rate variability is very strongly associated with the brain's ability to moderate or inhibit emotional impulses. So we may have a cause for hostility, we may have a cause for a fear response. If we have strong high heart rate variability, we're more likely to be able to moderate those processes. Strong prefrontal activity also facilitates a feeling of safety. So if you're prefrontal cortex and its inhibitory functions are chronically impaired, then the person or the organism is more likely to have a generalized feeling of unsafety and threat. And that person is not going to be able to turn to others for soothing when stress occurs because they don't feel safe to doing so. They're more likely to respond in a negative or hostile fashion. So increasing vagal activity assists the restoring of that perception that the world is safe. In a recent book chapter, Julia Went and Julian Thayer together proposed that heart rate variability is an index of what they call prefrontal cortex functionality. So how well is that prefrontal area of the brain functioning at this moment? Well, when there's high heart rate variability, it's likely to function very well. When there's low heart rate variability, it's not likely to work well. They also proposed that lower heart rate variability is, and this is a mouthful, but they called it a transdiagnostic marker of psychopathology. Well, psychopathology is abnormal cognitive and emotional experiencing. Psychopathology is abnormal psychology, the presence of disorders. Transdiagnostic means we're not concerned just with one diagnosis. It's across all psychological diagnoses. So when you have lower heart rate variability, it's the sign that a variety of psychological problems are present or will develop. You're more likely to see a person who's anxious, discouraged, angry, hostile, just a variety of negative emotions. And the contrary is also true. When you can increase heart rate variability, you're less likely to see all of these psychological problems. Now that fits with the empirical conclusion. A lot of empirical studies are taking place now measuring the impact of heart rate variability training on anxiety disorders, depression, and PTSD. And in general, when you train the person to deliberately increase the variability of their heart rate, you see improvements in anxiety symptoms, depressive symptoms, and trauma symptoms. So we see if with high heart rate variability, trait anxiety is reduced. The effects of emotional dysregulation on depression are reduced. The ability of the prefrontal cortex to inhibit and regulate subcortical emotional centers is increased. And all of these things make psychotherapy more successful. These are actually some of the effects that we're trying for in psychotherapy, and simply doing some kind of mind-body strategy at the beginning of therapy will already take the person into a better state, which is much like what we want therapy itself to do, and therapy will be facilitated. So Julian Thayer also worked with Theodore Beauchesne, and they argued that low heart rate variability is what they call a general vulnerability factor. Lower flexibility in thinking, loss of the ability to find a perspective on events, and impaired processing, and vulnerability for many medical and psychiatric illnesses. We know that cardiovascular illness is worse when heart rate variability is low. If you have a large population, and this has been done in several studies, if you take a large population of patients who have had a heart attack and you look at their heart rate variability, those with higher heart rate variability are more likely to survive long term. Those with lower heart rate variability are more likely to have additional cardiovascular episodes, and they're more likely to die, including sudden cardiac death. So we know that there is a vulnerability whenever heart rate variability is lower. One more example would be some research on diabetes that showed that in people who live with chronic diabetes, we see a decrease in heart rate variability before the development of diabetic neuropathy. So it's a sign that the organism is becoming less healthy, and it happens before the onset of neuropathy. So it becomes more and more wise in healthcare to be monitoring heart rate variability, because it's an indication when it's low, it's an indication things are getting worse. Whether you're a psychologist, a cardiologist, a nutritionist, it's a valuable marker. Now, this was another team of researchers publishing in the Journal of Personalized Medicine. This is a journal dedicated to individualized medicine, where we try to tailor the intervention to the person's own current condition, not just to their diagnosis, because not everybody with high blood pressure has the same mechanisms involved. Not everybody with cardiovascular illness is going to respond to the same medication. So in the Journal of Personalized Medicine, Cattaneo and colleagues published a systematic review of research on heart rate variability, executive function or thinking, and emotion regulation. And they stated that heart rate variability is a credible marker for the amount of stress currently impacting the person. It's also a marker for how effectively the person is coping with their current threats. So it's a marker for emotional regulation, and when it's low, both self-control and impulse control are poor. Interestingly, I used to use heart rate variability training with my neurofeedback patients. These are patients where I'm going to try to train their brain by giving them feedback on brain processes during the therapy session. And I used to start with heart rate variability simply because it was easier to learn, and then I would move to brain-oriented neurofeedback. What I learn now, and research is pointing this out, is that when you do heart rate variability, you're already affecting brain. You're increasing attentiveness, you're increasing clear thinking, flexible thinking, and the ability to develop perspective. Neuropsychological studies now show lower performance on attention tasks, memory tasks, and greater impulsiveness in groups with lower heart rate variability. And in turn, when you train higher heart rate variability, you see just the opposite. Better attentiveness, better performance on memory tasks, and better management of impulses. So it is recommended now for use with people with traumatic brain injury as well as people with chronic attention deficit. This is just a schema that Cattaneo, a figure or graph that Cattaneo and colleagues used to illustrate their findings. Low heart rate variability is associated with dysfunction in the frontal lobe, emotional dysregulation, and psychopathology, personality disorders, addiction, schizophrenia, and attention deficit. So their study supports the Wendt and Thayer claim that lower heart rate variability is a marker for psychopathology across diagnoses. It's not just something that affects anxiety disorders or depression. It's across diagnoses. Shifting gears once again, watching my time, Paul Gilbert. Now, Paul Gilbert is a Brit. He's a pioneer who developed compassion-focused therapy. Compassion-focused therapy is an interesting approach to psychotherapy because it doesn't try to create entirely its own techniques. It borrows techniques from a variety of cognitive therapies and other therapies, but the therapy puts an emphasis on developing the capacity for compassion. Gilbert, like Steve Porges, emphasizes that benevolent, caring relationships emerged in the course of evolution, along with the emergence of the maternal caretaking role and the long-term vulnerability of the infant. At the same time, our physiology developed supports in the nervous system for compassion, for enabling this caring, compassionate capacity. There we go. So the structure of the autonomic nervous system parallels this opposition between threat on the one hand, safety on the other hand. When we're threatened, the sympathetic nervous system activates. When we're resting, digesting, tending, befriending, we have activation of the parasympathetic system. And that parasympathetic activation modulates the sympathetic activation. It acts as a kind of a brake on sympathetic responses, facilitating a sense of safety and the emergence of caring, and also soothing and the ability to calm and rest. Gilbert found that if he trained compassion, it already increased vagal nerve activation and vagal tone. So higher vagal activation is correlated with empathy, kindness, and thoughtfulness. So on the one hand, if you train compassion, you get more vagal activity. On the other hand, if you train vagal activity, do any kind of mind-body strategy that enhances vagal activation, you also get more compassion. So again, it's a two-way street. Gilbert concluded that heart rate variability biofeedback, diet, and physical exercise are all pathways to increase vagal activation. And I'll come back to that. There are many pathways. Now, I keep referring to heart rate variability. What do I mean by that? Well, that's the moment-to-moment changes in heart rate. It's one indication of the overall level of health and resilience in an organism. Heart rate variability is low when illness is present. It also gets lower with aging. It also gets lower with sedentary lifestyle, and that undermines health. We find the highest heart rate variability in young, aerobically active and healthy subjects. From moment to moment in a healthy organism, heart rate variability goes up, or heart rate rather, goes up and goes down. That's the variability. In high-level athletes, you may see swings of 50 beats between the highest heart rate and the lowest heart rate in an organized oscillation. This was true for the Milan soccer players who won the World Cup quite a few years ago. And later, my colleague Fred Schaefer at Truman State University worked with healthy athletic undergrads and found that they too could produce swings in heart rate of 40 to 50 beats. And that's correlated with strong parasympathetic activation, positive autonomic nervous system regulation. So what do? We certainly want to help people set aside sedentary lifestyles and become more active, moving much more regularly throughout the day, and adapting healthy lifestyles generally. And if we do this, already we're going to see higher levels of compassion and attunement to others. On the one hand, we can train people in compassion directly, and there are a variety of protocols for training people in compassion. And when we do, we see more compassionate engagement. We also see an increase in that heart rate variability. Or we can start on the body side and we can directly train heart rate variability, and we will see increases in measures of compassion and self-compassion. One of our doctoral students in mind-body medicine did a dissertation based on Steve Porges's theories. She trained people in 3 different types of breath training. One of them was a method promoted by Heart Math Institute, but there were 2 other breathing training protocols she followed. Each of them involved learning to breathe from the diaphragm slowly, evenly. Emphasis on slowing that breath. All 3 groups engaging in breath training showed increases on measures of compassion and self-compassion. She did not train compassion. She trained breathing, and she got changes in compassion and self-compassion. Very interesting doctoral dissertation. Okay, that's all physiology. That's the autonomic nervous system. That's heart rate variability. That's vagal activity. Now we're going to look at hormones. Kirsten Uvnes Moberg identified what she called the oxytocin factor, labeling oxytocin as the hormone of calm, love, and healing. Oxytocin is a peptide hormone. We see increases in oxytocin when bonding is going on. Also during sex, during sexual intercourse, we produce more oxytocin, enhancing that feeling of closeness. Oxytocin is produced at greater levels during childbirth, also during breastfeeding, as well as in relaxation and feelings of calm. It's produced in the hypothalamus, released by the pituitary. Again, oxytocin production, also the release of oxytocin, are increased during childbirth, breastfeeding, sexual intercourse. Higher levels of oxytocin are conducive to pair bonding and a sense of connectedness. Higher oxytocin levels also reverse many of the effects of the stress response. So once again, we're seeing multiple effects supported by our physiology, in this case by hormones. Kemp and colleagues did research and demonstrated that increased oxytocin also increases heart rate variability. Interestingly, the vagus nerve has multiple oxytocin receptors. It's dense with oxytocin receptors. So when oxytocin is released, the vagus nerve is activated because the oxytocin directly impacts it. In turn, if we increase vagal activity, oxytocin is distributed at higher levels in the peripheral bloodstream. So it becomes present and available throughout the body. So once again, we've got these two-way pathways between the autonomic nervous system and our hormone system. Together, vagal activation and oxytocin facilitate social engagement, social connection. They moderate the effects of the stress response. If we train people through breathing, through meditation, through biofeedback, to increase the swings in heart rate, the heart rate variability, it improves blood flow and it improves this functional connection within the nervous system. So we're getting all of these effects again. So once again, there are many pathways. I'm a biofeedback practitioner. So when I think of increasing heart rate variability, I'm thinking about training someone to breathe slowly at a specific rate of breathing that we call the resonance frequency. When they do that, when they breathe at the resonance frequency, this is the breathing rate that produces the highest variability in heart rate. So I'm thinking about training someone directly to look at my computer screen or to look at their tablet or their smartphone and watch the heart rate oscillations as they breathe slowly at a specific rate, which is ideal for them. But there are many other pathways that have some of these same effects, and that's what I'm going to talk about here. The most investigated methods of increasing heart rate variability are exercise, heart rate variability biofeedback, slow breathing, meditation, mindfulness interventions, and supplementing omega-3 fatty acids. So that's a summary from Julia Wendt and Julian Thayer from their recent book chapter. Again, I've mentioned heart rate variability training and resonance frequency. Paul Lehrer is the psychologist at Rutgers who developed the protocol for heart rate variability training. He actually brought this technology from St. Petersburg, Russia, where it was experimental, brought it to the United States and demonstrated with some very thorough research how valuable it could be and how it could benefit people with a variety of mental health disorders and medical disorders, including asthma, which was a particular interest of Paul. When you're doing heart rate variability biofeedback, the first thing you do is you assess what is the breathing rate for this person that produces the greatest heart rate variability, the greatest oscillations in heart rate. So I have somebody breathe at 7.5 breaths a minute, 7, 6.5, 6, 5.5, 5, and 4.5. And meanwhile, I'm watching the computer screen and determining which of these breathing rates produces the best variability. Once we know that, we guide the person to practice at home and in the office using a breath pacer or using a biofeedback device. Today, it's so easy because there are so many consumer-oriented heart rate variability devices, but also so many apps available on the smartphone for pacing your breath. If you regularly practice breathing at that rate that we've measured for you, you will get increases in heart rate variability during the practice, but you will also get increases in heart rate variability over time in your everyday life. And you will see a variety of improvements in health, emotions, resilience, even peak performance in athletics. But there are other pathways. Hypnosis. Diamond, way back in 2008, did a study evaluating the connection between how deep you go in trance and the amplitude of heart rate variability. He had people shut their eyes but use a joystick to measure at each moment that he played a tone, reminding them to measure how deep they were in trance. And they used the joystick to measure how deep they were. And what he found was a very high correlation. The deeper they were in trance, the higher the heart rate variability was. The less deep the trance, the lower the heart rate variability. The connection was so great that he called heart rate variability a hypnometer. It was a gauge of how deep the trance is. Later research, Yüksel and others, did research on hypnosis in 25 adults and found increases in several heart rate variability variables following hypnosis. Now, this was most significant in women, although others have reported it in males as well. Fernandez reviewed 14 different studies in a systematic review and concluded that there was consistent evidence that hypnosis elicits an increase in heart rate variability. There's an article in press right now by Victor Padilla, Gary Elkins, and others, which will appear in a special issue of the journal Applied Psychophysiology and Biofeedback. And they are confirming this conclusion that hypnosis can optimize heart rate variability, and they included some case narratives in that article, which it will become available online in advance of print publication quite soon. And by the way, I have a bibliography for all of these research articles for anybody who's interested. Meditation. Well, Bornemann did a very complicated study, but basically what Bornemann and colleagues were interested in is if you do ongoing meditation over time, what happens to vagal activity and heart rate variability. And they concluded that meditation is a tool that increases higher vagal activity, higher heart rate variability. So they concluded that contemplative mental training, that is meditation, can build a healthier and more caring society. Diet. Well, Young and Benton cited several studies that simply showed that weight loss increases heart rate variability. If you are overweight or obese, it reduces heart rate variability. If you lose weight and enter a normal weight range, it enhances heart rate variability. Suarez Miranda and colleagues did a study on trans fat consumption, and they found that greater healthy trans fat consumption lowered heart rate variability, and the effect persisted for 5 or more years. So these are polyunsaturated trans fats of the type what they call 18:2. These, no, I'm sorry, the unhealthy trans fatty acids are the 18.2 category, and those are associated with sudden cardiac death. So what we want to do is take in omega-3 fatty acids, which reduce heart rate and increase heart rate variability. If we have the wrong type of fatty acids, it's more likely to lead to cardiovascular illness, even sudden cardiac death. Young and Benton, who I cited earlier about obesity, also reported evidence that the Mediterranean diet increases heart rate variability. They found that following a Mediterranean diet enhanced heart rate variability, enhanced vagal activity, and there were specific elements in that diet which they emphasized: enriched yogurt, nut consumption, and red wine. So every time I sip a little red wine, not too much, a little red wine enhances heart rate variability. Exercise. Well, we know that higher levels of aerobic activity are associated with higher baseline heart rate variability. Young people who are aerobically active will have the highest baseline heart rate variability and will also show the largest increases if we engage in heart rate variability training. On the other hand, sedentary lifestyle is associated with lower baseline heart rate variability. So exercise therapy and exercise activity produce increases in heart rate variability, even in persons with cardiovascular illness, even in those with obesity and diabetes. So of course, we would like to reduce that obesity, but even if you're going to stay overweight, exercise therapy and exercise activity will enhance heart rate variability. So I'm getting close in time, so I have to start talking about what does all this mean? Well, one of our fundamental challenges of human development is the actualization of the capacity for caring and compassion. Hatefulness, violence toward others, malicious destruction, all of these things happen in the absence of compassion and caring. Adverse childhood experiences disrupt the development of a deep sense of safety, which is a precondition for compassion. Creating conditions therapeutically and in education, conditions of safety and safeness, compensates for past trauma. Physiological supports can facilitate this process. Psychotherapy has to involve more than just cognitive change. Rather, it requires corrective emotional experiences, restoring a capacity for trust, safety, and compassion, and a number of mind-body strategies, such as heart rate variability biofeedback, paced breathing, meditation, and other mind-body strategies will optimize psychotherapy. So what's the impact on psychotherapy? Those of you who are not psychotherapists, think about if you did 5 minutes or even 3 minutes of slow breathing with your patient before your medical session, before your nutrition session, before your exercise physiology session, before your training, your fitness training session. If we engage in mind-body strategies that optimize heart rate variability and vagal activity, it facilitates caring and compassion, emotion regulation. It enhances cognitive flexibility, the ability to gain perspective, or as it's called, perspective taking, and executive functioning. My prefrontal cortex, the executive control center of the brain, will operate more effectively and will engage in emotion regulation more effectively if I'm able to elicit these optimal vagal nervous system states. So we're facilitating a positive therapeutic transformation. We're also facilitating a positive engagement with a medical provider. So what we're looking at is something that happens throughout our body. Many people emphasize the autonomic nervous system, the parasympathetic system, but the brain is also involved. Our central nervous system is also involved, enabling compassion, enabling social engagement. Vagal input and vagally mediated heart rate variability are major contributors to learning how to regulate our emotions. And also, they facilitate the executive center of the brain, the frontal lobe, to engage effectively and connect well with the emotional brain. Oxytocin also enhances both relaxation and social engagement, reversing many of the effects of the stress response. And oxytocin elicits more optimal vagal activity. In turn, more optimal vagal activity will activate more release of oxytocin. Engaging in breathing exercises, again, even just for a few moments at the beginning of an activity, will optimize the physiology, will optimize the hormonal balance for an effective psychotherapeutic session, an effective session in healthcare, nursing, nutrition, eliciting greater cognitive flexibility, gaining perspective, overall cognitive function. It's beneficial for anyone in a healthcare encounter. Let's take a couple of moments now. I usually do this at the beginning of a session, but I was afraid I would not have time to finish if I did it. But let's take a couple minutes now. Notice what you're feeling in your body and your mind. I don't know what your day has been like. I don't know what your afternoon is going to be like. But let's take a couple of moments now. Get comfortable where you're sitting. Releasing any tension of the day. Releasing any sense of stress and deadlines. And allow yourself to breathe comfortably, slowly, smoothly. Allowing your breathing to come from the diaphragm, not from the chest, but from the diaphragm. Taking long, slow breaths. For many people, breathing in through the nose and out through the mouth is optimal, but that's not essential. If you're congested, breathe any way that's most comfortable for you. For many people, breathing out longer than the in-breath is optimal, but again, this isn't true for everyone. But try that out. See if you can take in a long, slow inhale and then an even longer, slow exhale. Breathing slowly, breathing gently, breathing smoothly. And be aware, don't do this with any effort. Don't go gasping the air in or out. Breathe gently. Breathing gently, slowly, comfortably. And notice the changes in your mind and in your body. And continue another minute. According to the lecture I've just gone through, when we continue doing this and begin to doing it more frequently in our everyday life, at home and throughout our life, it will enable engagement with one another. It will enable our engagement with our clients, our patients, their engagement with us. It will enable us to gain perspective, to be flexible in our thinking, and it will facilitate our patients to be able to think flexibly, to adapt new perspectives, to help them from their stuckness, to help us from our stuckness. It will help us with our emotional regulation. Decreasing a stuck negativity, enhancing the ability to respond both negatively and positively, flexible emotionality, to be able to feel sadness when we are feeling loss, to recognize threat and respond with caution, but then to recover a sense of safety, reaching out to others effectively, connecting with those that we can trust, where we feel that sense of safety and trust. Breathing slowly, evenly, gently. If you want to learn more about these connections between our physiology, our mind and emotions, the book depicted on the screen is available now on Amazon, Integrating Psychotherapy and Psychophysiology, some really top authors in the field. There will be a special edition of the journal Applied Psychophysiology and Biofeedback. It will officially come out in fall 25, but many of the articles will be available in the next few weeks. As soon as they're fully edited and accepted, they will go online and available. And now if anyone has comments, questions, open your eyes, stretch.